The Senate Finance Committee chamber simmered with electric tension, the air thick with the gravity of a high-stakes confrontation set to influence the national conversation on American healthcare. Senator John Neely Kennedy, the sharp-tongued Republican from Louisiana, sat composed at his desk, his calm posture and gleaming glasses masking a determined commitment to truth and reason. His measured gaze scanned the room, observing lawmakers, aides, and reporters bracing for the clash ahead. Opposite him, Senator Bernie Sanders of Vermont burst into a fiery opening, his voice crashing through the chamber as he accused the American medical establishment of being deeply compromised by the pharmaceutical industry's financial power. Waving a stack of documents like a weapon, Sanders asserted that the American Medical Association, along with the American Academy of Pediatrics and the American Public Health Association, had been thoroughly co-opted. He urged Americans to question their doctors' vaccine advice, particularly regarding COVID-19. Citing soaring drug prices and political donations as proof of a system corrupted by corporate greed, declaring that pharmaceutical greed was everywhere. Sanders' gestures grew broader as his voice rose, echoing off the chamber walls as he claimed they charged the highest prices in the world and had influence over nearly every medical body. Kennedy, unshaken, leaned into his microphone, his southern drawl cutting through the charged atmosphere with precision shaped by years of debate. Locking eyes with Sanders, he calmly but firmly distinguished between established science and what he called reckless claims that erode public trust in healthcare. He reminded the chamber of his record pushing for drug price transparency while defending medical science, warning that portraying the AMA and pediatricians as corrupt was a dangerous path. Citing a Lancet study showing COVID vaccines prevented nearly 20 million deaths in their first year, Kennedy emphasized how vaccines saved lives and restored livelihoods. Accusing Sanders of spreading doubt without credible evidence, his tone remained sharp yet controlled, never personal. Sanders responded by doubling down, his face tightening as he leaned forward, accusing Big Pharma of owning the medical establishment and charging Americans more than anyone else globally, pointing again to campaign donations and alleging politicians were bought by pharmaceutical money. Once more questioning how any system so saturated with corporate cash could be trusted. He pressed his argument, clearly aiming to shake the committee and energize the audience in the gallery and beyond, their murmurs rippling through the chamber. Kennedy did not flinch. "Let's talk facts, Senator," he replied, his voice marked by the steady cadence of a veteran debater who commanded attention without raising it. He reminded the room that he had fought pharmaceutical excesses himself, pushed legislation to rein in middlemen inflating drug prices, and backed transparency so Americans would not be fleeced at the pharmacy counter. But to claim that every doctor, every scientist, every institution was bought and paid for, he said, was not just wrong, but reckless. He pointed to the AMA's ongoing work to reduce healthcare costs from rural Louisiana clinics to major urban hospitals, and to pediatricians whose vaccination programs had helped eradicate diseases like measles. "You're casting doubt on the very people who've made America healthier," Kennedy said, shaking his head with a blend of disbelief and resolve. He then addressed campaign money directly, noting that he too had accepted contributions from individuals like Sanders, asking whether that meant corruption or simply participation in a system needing reform rather than destruction. The chamber fell quiet as his words settled over the committee. He warned that telling Americans not to trust their doctors begged a dangerous question. What was the alternative? A few fringe voices over the consensus of hundreds of thousands of experts. That, he said, was not science, but chaos. He challenged Sanders to cite credible organizations supporting his claims. Sanders named a handful of advisors, but Kennedy countered swiftly that a few individuals could not outweigh the AM, the American Heart Association, or the global scientific community, emphasizing that while imperfect, these institutions were grounded in evidence. peer review, and decades of saving lives. He drew on examples from Louisiana, describing rural hospitals reliant on federal support and scientific progress to serve communities strained by poverty, warning that when trust in medicine eroded, vaccine hesitancy rose and preventable diseases returned, harming places like Shreveport and New Orleans. Kennedy also corrected Sanders' claim that a recent healthcare bill would devastate rural hospitals, stating it would deliver billions to community health centers, nursing homes, and rural clinics, strengthening rather than cutting care. As Sanders pushed back in frustration, suggesting Kennedy implied everyone else was corrupt, Kennedy chuckled softly, a brief grin easing the tension, before concluding that while the system was flawed, the science itself was not. Kennedy responded without hesitation. "Are they all corrupt?" he asked, pointing out that while the system is flawed and he had voted for transparency reforms to fix it, that did not make the science wrong. The medical community, he stressed, agrees that vaccines work. Noting that Sanders' sources amounted to a handful of doctors set against thousands. Expanding his argument, Kennedy turned to public health policy, his tone steady and authoritative, warning that undermining confidence in vaccines leads to outbreaks of diseases once thought eradicated. In Louisiana, he explained, sustained efforts to keep vaccination rates high had resulted in healthier communities. Progress that Sanders' approach threatened to undo. When Sanders attempted to interrupt, Kennedy held the floor and shifted to economics, acknowledging that high drug prices were a serious issue, which is why he had supported generics, biosimilars, and price negotiations to reduce costs without stifling innovation. But tying those concerns to a wholesale dismissal of medical organizations, he said, went too far. As the committee chair called for order amid the intensifying exchange, Kennedy remained composed, citing statistics from trusted sources to highlight the medical community's life-saving advances, from heart disease treatments to cancer therapies, arguing that dismissing these institutions as corrupt ignored their contributions. Sanders repeated that greed was pervasive, asking how such influence could be ignored. And Kennedy replied patiently that it should be confronted through reform, not destruction, emphasizing his support for bipartisan efforts and describing the AMA and similar bodies as partners rather than adversaries. As the first phase of the hearing drew to a close, Kennedy's arguments resonated, his blend of folksy charm and sharp logic making him a formidable presence, shifting the room from Sanders' fiery rhetoric to the weight of reasoned defense. This, Kennedy made clear, was more than a political clash. It was a defense of truth in an age of doubt. He concluded by reminding the chamber that the issue was ultimately about the American people, who deserve a healthcare system grounded in science rather than suspicion, urging cooperation to improve it rather than tear it down. The moment lingered as the audience anticipated the next phase of the confrontation, with Kennedy having laid a firm foundation as the hearing pressed on and the atmosphere grew even more charged. Sanders escalating his attack on the pharmaceutical industry, insisting its influence had ensnared major medical organizations and turned them into instruments of profit over public health. Sanders thundered that the corruption ran deep, slamming his fist on the table for emphasis as he declared that groups, like the AMA and the Academy of Pediatrics, were all compromised and that Americans should not blindly trust their doctors while Big Pharma pulled the strings. He painted a stark picture of a healthcare system where greed eclipsed science, drug prices soared, and institutions such as the American Public Health Association were more focused on cashing checks than protecting patients. Leaning forward with narrowed eyes, Sanders accused the establishment of silencing dissent and prioritizing corporate interests over ordinary people. Kennedy, maintaining his composed Southern poise, refused to let the rhetoric pass unchallenged, adjusting his microphone as his voice cut through the noise with surgical precision. He told Sanders he was twisting facts in a way that undermined public trust in science, calmly but firmly noting that the AMA alone represents hundreds of thousands of doctors who work daily to save lives, not enrich themselves, labeling them all corrupt. Kennedy said, was baseless and an insult to professionals who had eradicated diseases and extended lifespans, emphasizing that Sanders' sweeping claims ignored the peer review processes and ethical standards guiding these institutions. Turning the argument back, Kennedy asked pointedly whether it was really the scientific consensus that was isolated, or Sanders' reliance on a small circle of advisors. Sanders shot back, his voice rising as he insisted it was not fringe but truth, arguing that pharmaceutical companies charged the highest prices in the world and had bought off the establishment, with the AMA lobbying alongside them. He gestured broadly, urging the room to see past what he called a manufactured consensus and warning that people needed to question their doctors because the system was rotten at its core. Kennedy shook his head with a faint, confident smile, saying that questioning was healthy but baseless doubt was destructive, then cited modern medicine's achievements from vaccines that eradicated smallpox to HIV treatments that transformed a death sentence into a manageable condition, to cancer breakthroughs offering hope to millions. Drawing on his command of healthcare policy, he added that the AMA had long pushed for affordable access and data-driven reforms to counter overpricing. He added that the Academy of Pediatrics had led major child health initiatives, from nutrition guidelines to mental health support, and that dismissing it as manipulated was a slap in the face to the evidence-based progress it had driven. Kennedy's rebuttal grew relentless as he boxed Sanders in with pointed questions, asking that if these organizations were truly co-opted, why they had consistently pushed for lower drug costs and greater transparency, the very issues he had championed through bipartisan legislation. As the exchange intensified, Sanders tried to pivot again, naming advisors like Marty McCary, Jay Bakura, and a few others as the real voices of reason, insisting the establishment's consensus was manufactured. Kennedy seized on the weakness, his tone firm but fair, noting that a handful of individuals could not outweigh the collective judgment of hundreds of thousands, calling it not a debate but a disparity. He stressed that the scientific establishment was not a shadowy cabal, but a network of experts, committed to peer-reviewed truth, warning that Sanders' rhetoric was what truly eroded public confidence, risking lower vaccination rates and the return of preventable diseases. Bringing the focus back to real-world consequences, Kennedy cited Louisiana, where trust in doctors had fueled successful health campaigns, from rural heart disease screenings guided by the American Heart Association to broader community health gains, cautioning that undermining that trust fostered harm, not reform. Sensing the shift, Sanders grew more animated, arguing that pharmaceutical money tainted everyone across party lines. Kennedy acknowledged the broken campaign finance system and reiterated his support for reforms to limit dark money and expand disclosure, but rejected the idea that donations corrupted the core of science, noting that both of them had taken contributions while his votes reflected constituent needs for affordable medicines, reliable research, and accountable industry practices. Turning the logic back on Sanders, he asked whether the presence of political money invalidated the entire medical community's work, calling that a reckless leap that distracted from real solutions. The room hung on his words as he warned of the dangers of misinformation, questioning why the entire medical community was repeatedly dismissed when organizations like the AMA backed vaccines as safe and effective against a few isolated opinions, and asking who truly benefited from that division. Kennedy's delivery blended fact with empathy, underscoring that his argument was about protecting public health, not scoring points. When Sanders made one final push, accusing him of defending greedy institutions and decrying exorbitant drug prices, Kennedy countered smoothly, ready to separate justified criticism from destructive distrust. Kennedy acknowledged that greed existed in parts of the system and explained that this was why he had introduced legislation to cap prices, promote generics, and hold middlemen accountable. But he rejected the notion that this meant the scientific establishment was co-opted, stressing that the AMA and similar organizations had been allies in those efforts by providing the data needed to succeed. He posed a final rhetorical challenge, asking that if everyone was corrupt except Sanders and a select few, anyone could build a better system through suspicion or through collaboration. As this chapter of the intense confrontation unfolded, Kennedy's composure and depth stood out, revealing the weakness of Sanders' sweeping accusations while reaffirming the importance of trusted institutions. His calm under pressure, paired with logic and real-world examples, showed why he was regarded as a defender of rational policy. The debate continued to rage, but Kennedy had lifted it beyond shouting into a substantive clash, pushing Sanders onto the defensive and reminding the room of what was at stake: a healthcare system grounded in truth rather than fear. The stakes were unmistakable, and Kennedy appeared firmly in control, his arguments building steadily like a wave ready to break over the opposition. The Senate Finance Committee chamber crackled with intensity as the exchange between Senator John Kennedy and Senator Bernie Sanders moved into its next phase, the air heavy with anticipation as ideas collided and the future of public trust in healthcare and medical policy loomed large. Kennedy, the sharp-witted Republican from Louisiana, sat with unshakable resolve, his glasses catching the chamber lights as he shifted from defense to a confident offensive. Having already exposed the fragility of Sanders' claims and now steering the Watt discussion toward solutions while dismantling accusations with precision, Sanders, undeterred by the growing pressure, leaned forward again, his voice charged with conviction as he renewed his assault on the pharmaceutical industry and its alleged stranglehold on America's medical institutions. Repeating that the corruption ran deep, Sanders slammed his fist on the table, thundering that the American Medical Association, the Academy of Pediatrics, and the Public Health Association were all in Big Pharma's pocket, pushing vaccines and treatments for profit rather than health, and warning that Americans should not blindly trust their doctors when corporate greed was pulling the strings. Kennedy, composed and authoritative, calmly adjusted his microphone, his southern drawl cutting cleanly through the rhetoric as he locked eyes with Sanders and challenged him directly. He said Sanders had spent the day hurling accusations that painted the entire medical community as corrupt, then demanded to know which organizations actually supported his claims, pointing out that Sanders had named only a few individuals while lacking any broad consensus. Kennedy emphasized that the AMA, representing hundreds of thousands of doctors, along with pediatricians protecting children and public health experts combating disease, stood united on the safety and effectiveness of vaccines. And he pressed Sanders on, who truly agreed with casting doubt on these foundations of science. The question lingered in the chamber, forcing Sanders to confront the weakness of his position. After a brief hesitation, Sanders responded that his primary advisors were experts like Marty Meekry, J. Peggy Baccara, and others who, he claimed, saw through the establishment's facade and spoke the truth. Kennedy nodded briefly, but replied with sharp precision, noting that Sanders was relying on a few doctors while he was pointing to organizations representing vast numbers of physicians and scientists rooted in peer-reviewed evidence. He drew a clear line between established science and isolated opinions amplified for effect, pausing to let the contrast register before pressing further. Kennedy asked where Sanders' advisors received their funding and what their peer-reviewed track records were, contrasting that with the AMA's decades of data-driven advocacy and the Academy of Pediatrics leadership in campaigns that eradicated diseases like measles. Then pointedly asked what equivalent accomplishments Sanders' advisors could claim. Members of the committee shifted in their seats, some nodding as Kennedy's logic landed with force. Sanders tried to rally, his voice rising defiantly as he insisted these were not just any doctors, but voices challenging a system he claimed had been captured by pharmaceutical greed. Asterisk. Sanders insisted that the AMA lobbied alongside the pharmaceutical industry. But Kennedy immediately pushed back, his tone firm yet measured. He warned that claiming the AMA, with its long history of advocating for patient rights since 1847, had been bought out and that Americans should distrust their doctors while only a select few voices were deemed pure sounded more like a conspiracy than a serious critique. His calm delivery masked relentless questioning that steadily exposed the weakness of Sanders's sweeping assertions. Kennedy pointed to his own record on transparency, reminding the committee that he had introduced legislation to expose drug pricing practices and rein in middlemen, particularly pharmacy benefit managers who profited while patients paid the price, all without dismantling the institutions that supplied the evidence needed to enact reform. He stressed that the AMA had been a partner in these efforts, not a barrier. As the exchange deepened, Kennedy redirected the discussion toward solutions, acknowledging shared concerns about the pharmaceutical industry's high prices and opaque practices while arguing that meaningful reform required mandatory price disclosures, caps on out-of-pocket costs, and incentives for generics, measures he had co-sponsored across party lines. Turning to the committee, he cautioned that progress could not come from eroding trust in science, insisting that reform must build on expert consensus rather than tear it down. Drawing from Louisiana, he described how federal support for rural hospitals expanded access to vaccines, screenings, and treatments guided by proven standards from organizations like the AMA and the American Heart Association. When Sanders interrupted, accusing the reforms of being superficial and harmful to rural health care, Kennedy countered with detailed facts, stating that the bill in question represented the largest federal investment in rural health care ever, reallocating resources from wasteful areas to community health centers, nursing homes, and underserved regions. He explained how this translated into more doctors in small towns, improved telehealth, and stronger preventive care, framing it as a smart investment rather than a loss, emphasizing collaboration over confrontation. Kennedy argued for increasing pharmaceutical transparency without discarding the scientific foundation, supporting audits of campaign contributions while preserving the institutions that guide medical policy. As the room absorbed his vision, Sanders continued pressing, his voice growing more animated as he repeated that the medical community stood united on what he claimed was the wrong side, compromised by industry influence. Kennedy answered with a knowing smile, his composure intact as he pointed out that the entire medical community, from the AMA representing hundreds of thousands of physicians, to pediatricians protecting children to the Heart Association battling chronic disease, consistently affirmed that vaccines are safe and effective, supported by studies like those in The Lancet showing millions of lives saved. He accused Sanders of sowing doubt based on a few contrarian voices and challenged him again to name the organizations that agreed with him. When Sanders stumbled and repeated individual names, Kennedy pressed the contrast with unmistakable clarity, emphasizing that it was hundreds of thousands versus a handful, and that the scientific establishment had been the foundation of medical progress, not a servant of greed. Kennedy's offensive blended sharp questioning with a broader call to action, stressing that healthcare improves by working with trusted institutions while holding them accountable, not by alienating them, and urging investment in research, stronger oversight of drug approvals, and community programs that prevent illness before it begins. He underscored his record supporting rural healthcare and fighting price gouging, presenting himself as a practical reformer amid exaggerated claims. With Sanders now clearly on the defensive and attempting to return to accusations of pervasive greed and high prices, Kennedy partially agreed, acknowledging that greed exists and that American drug prices are a serious problem, which is why he supported negotiations, importing cheaper generics from Canada and capping seniors' costs. But he firmly rejected the idea that disagreement justified branding every institution, from the AMA to pediatric groups, as corrupt, calling such claims an insult. Kennedy noted that people disagreed with him all the time and that he engaged in heated arguments daily with colleagues. But those debates were grounded in facts, not fear. Before posing a final rhetorical challenge, if everyone was corrupt except Sanders and a select few, how could a better system be built? Through suspicion or through collaboration rooted in evidence? He reinforced his stance with examples from Louisiana, describing how science-driven vaccination campaigns had sharply reduced childhood disease rates and heart health initiatives had lowered mortality, warning that undermining trust risked the return of diseases once thought eliminated. He pointed to his fight for funding to keep rural hospitals open so small-town communities would not lose access to care, calling that the essence of evidence-based policy, strengthening institutions rather than tearing them down. Sanders made one last attempt, claiming Kennedy's bill would devastate rural health care. But Kennedy responded calmly that it was strategic, cutting inefficiencies and reinvesting in clinics, telehealth, and preventive care to deliver more care to more people, not less. His command of the details drew murmurs of approval from the committee. And as this phase of the hearing unfolded, Kennedy emerged as the clear leader, not only dismantling Sanders's arguments, but laying out a reform path that inspired confidence. His mix of pointed questions, practical solutions, and steadfast support for science resonated deeply, underscoring that true leadership advances progress through unity rather than doubt. Though the confrontation was not yet finished, Kennedy's strategic shift placed him firmly in control, his vision for a fair, fact-based healthcare system shining amid the contentious debate. As the Senate Finance Committee hearing wound down, the storm of tension eased, leaving Kennedy as the apparent victor in the battle of ideas. His performance marked by sharp intellect, firm facts, and a visible commitment to the American people that reduced Sanders's claims to fragments. Kennedy leaned back quietly as the chairman called for final remarks, his expression reflecting restrained satisfaction. Sanders, his face flushed from the heated exchanges, yielded the floor with a reluctant nod. The fire of his earlier rhetoric dimmed under the weight of Kennedy's methodical rebuttal. The chamber, filled with lawmakers, aides, and onlookers, seemed to exhale collectively, the tension shifting from confrontation to sober reflection on the gravity of the issues discussed. Kennedy stood to deliver his closing statement, his southern drawl carrying both authority and warmth as he addressed the room. He noted that much had been said about corruption, greed, and doubt. But what had truly been revealed was the danger of allowing unsubstantiated claims to weaken the foundations of the healthcare system, pausing to let the point settle. He acknowledged that Sanders had raised legitimate concerns about high drug prices and industry influence, battles Kennedy said he had fought throughout his career, but warned that portraying the entire medical community, from the AMA to pediatricians, as compromised was not only wrong but harmful, sowing division where unity was needed and fear where facts should prevail. Kennedy's dominance was evident not merely in dismantling Sanders's arguments, but in elevating the exchange, transforming heated rhetoric into a discussion centered on progress. He emphasized that established science had once again prevailed over fringe theories, pointing to the consensus of hundreds of thousands of experts, including the AMA, the Academy of Pediatrics, and public health organizations, all affirming the safety and effectiveness of vaccines, supported by studies like those in The Lancet showing millions of lives saved. He contrasted this with Sanders's reliance on a small number of individuals, which he said could not withstand the weight of overwhelming evidence. Kennedy reinforced his position by returning to concrete reforms he had outlined, including transparency measures, pricing caps, and sustained support for rural hospitals, noting that the legislation under debate would inject billions into community care and strengthen America's health system without inviting the chaos born of unfounded doubt, making clear that his aim extended beyond winning the argument to securing lasting progress. He shifted smoothly into broader lessons, his tone becoming instructive and uplifting as he explained that the debate offered clear takeaways for all Americans. Truth and science, he said, must be defended through rational dialogue and transparency, especially in an era of misinformation where alarmism can easily take hold, while fact-based criticism leads to progress rather than fear-driven division. Speaking as if to families watching at home, he warned that questioning institutions without evidence risks lives, lowers vaccination rates, revives preventable diseases, and drives up costs through distrust, urging people to separate legitimate concerns like drug pricing from unfounded attacks that undermine advancement. Kennedy expanded on this point with clarity, stressing that cooperation is essential to building a fairer healthcare system, requiring Democrats and Republicans, experts and lawmakers to work together, as he had done through bipartisan efforts to negotiate prices and expand generics. Suspicion, he said, divides while collaboration unites, encouraging parents to let children ask questions but to guide them toward credible evidence from trusted institutions rather than echo chambers. Drawing briefly from Louisiana, he described communities thriving when trust in doctors led to better outcomes, stronger preventive care, and savings of both money and lives, calling it a fact-based, inclusive, forward-looking model. He concluded with a firm yet hopeful call to action, stating that the lesson was clear: protect science through open minds and honest debate, reject alarmist talking points without solutions, and embrace cooperation to build an effective and equitable system, whether as parents making vaccine decisions or voters seeking reform. He reminded Americans that truth prevails when given space. As Kennedy stepped back, the chamber filled with murmurs of agreement. Sanders's position effectively dismantled, and the hearing closed on a note of clarity, with Kennedy's leadership standing as a symbol of rational discourse in turbulent times. The exchange, he implied, was more than political spectacle. It was a lesson that improving health requires evidence over exaggeration and unity over division, reinforcing the belief that with leaders grounded in science, compassion, and common sense, the nation's healthcare future remains hopeful.